so important so we can understand it better and intervene to prevent this from happening in the future. I want to go into a little bit more detail first on what we are doing to promote safe and effective care, and then on the investigation. In terms of safe and effective care, we had already begun several days ago to ramp up the education and training of healthcare workers at this facility. The care of Ebola can be done safely, but it's hard to do it safely. It requires meticulous and scrupulous attention to infection control, and even a single inadvertent innocent slip can result in contamination. Second, we are recommending to the facility that the number of workers who care for anyone with suspected Ebola be kept to an absolute minimum. Third, we recommend that the procedures that are undertaken to support the care of that individual be limited solely to essential procedures. Fourth, we're looking at personal protective equipment, understanding that there is a balance, and putting more on isn't always safer. It may make it harder to provide effective care. So all aspects of personal protective equipment. And fifth, we're recommending that there be a full-time individual who's responsible only for the oversight, supervision, and monitoring of effective infection control while any patient with suspected or confirmed Ebola is being cared for. CDC has sent additional staff to Texas to assist with this response, and we will continue to work closely with them. In the investigation itself, we look at 3 different phases. What happens before someone goes in to an area where someone with suspected or confirmed Ebola is being cared for, what happens in that space, and what happens when they leave. The 2 areas where we will be looking particularly closely is the performance of kidney dialysis and respiratory intubation. Both of those procedures may spread contaminated materials and are considered high-risk procedures. They were undertaken on the index patient as a desperate measure to try to save his life. In taking off respiratory protective equipment, we identify this as a major potential area for risk. When you have gone into and potentially soiled or contaminated gloves or masks or other things, to remove those without any risk of any contaminated material touching you and being then on your clothes or face or skin and leading to an infection is critically important and not easy to do right. So these are areas that the investigation will look at, but we don't know what it will find. We'll be doing that over the coming days. Before I turn it over to Dr. Lakey, the Commissioner of the Texas Department of State Health Services, I do want to make 2 final points. The first is that, unfortunately, it is possible in the coming days that we will see additional cases of Ebola. This is because the healthcare workers who cared for this individual may have had a breach of the same nature of the individual who appears now to have a preliminary positive test. That risk is in the 48 people who are being monitored, all of whom have been tested daily, none of whom so far have developed symptoms or fever, and in any other healthcare workers who may have been exposed to this index patient while he was being cared for. We're still determining how many healthcare workers that will be. That is an intensive investigation. It takes many hours of tracing steps. We'll always cast the net wider. There, though, is no risk to people outside of that circle of the healthcare workers who cared for the individual patient and the initial 48 patients or contacts who had definite or possible contact with the index patient who we've already identified. The second point I want to make is that what we do to stop Ebola is to break the links of transmission, to break the chains of transmission. And we do that by making sure that every person with Ebola is promptly diagnosed, that they're promptly isolated, that we identify their contacts, and that we actively monitor their contacts every day for 21 days, and if they develop symptoms or fever, we do the same process again. That's how we have stopped every Ebola outbreak in history except the one currently in West Africa. That's how we stopped it in Lagos, Nigeria. That's how we will stop it in Dallas. So breaking the links in the chain of transmission is the key to preventing further spread. I'd now like to turn it over to Dr. Lakey.
Thank you, Dr. Frieden. This is David Lakey, the Commissioner of Health for the state of Texas. And I appreciate all the support from the CDC that the CDC has given us, not only over the night, but over the last several weeks as we've been working through this unprecedented event. Our staff have been working throughout the night, trying to gather more information, and as we get more information, as appropriate, we will provide that information. But as Dr. Frieden noted, we do have one healthcare worker, a healthcare worker that had extensive contact with our initial patient, who did what was appropriate with early symptoms, came in to be checked. And we facilitated getting the blood test done. That test came back at 9:30 last night, and as Dr. Frieden noted, was positive. The controls were appropriate. The amount of virus in her blood was less than what was there when the first index case came back, but it is a positive test. So our hearts really do go out to this individual and the family who is with us, a healthcare worker who is willing to compassionately care for Mr. Duncan, and again, our thoughts and prayers are with them. We have been preparing for events such as this, putting in contingency plans. And again, we're refining those plans, and a lot of work is taking place right now. As Dr. Frieden noted, the 48 original contacts continue to be monitored, and they continue to do well. And we have this one healthcare worker that now needs our care. And so, as Dr. Frieden noted, we are going to have been and will continue to monitor healthcare workers, stepping that up to make sure that any healthcare worker that has any fever or any other symptoms will be quickly identified, as was this individual. Continue to work to make sure the infection control practices that are being performed at the hospital are at the highest standards, and fully evaluating what is underway and figure out exactly what happened that allowed this individual to be infected. And we've brought in more public health officials, public health staff, epidemiologists to make sure that we have the individuals we need to fully evaluate the situation. And again, appreciate the work from the CDC and their support for Texas right now as we work through this situation. Thank you.
We will now take questions. We'll start in the room and then go to the phone.
Sure. Steve Gelbach from WSB-TV in Atlanta. This healthcare worker, you said multiple contacts with the original patient. In your interviews with her, has she been able to specifically isolate a chance where this may have occurred, where this breach, you say, in those interviews with her, talking about why you're specifically investigating maybe where she's taking off the equipment or anything, why you're focusing on that part in your investigation?
We have spoken with the healthcare worker, and that individual has not been able to identify a specific breach. The way we do investigations like this is we look at every single interaction, what was the nature of that interaction. We look at any other information we can gather. I was not mentioning the taking on or off PPE or the procedures related to the investigation, but as a general rule, these are the two areas where we see the greatest risk.
And to follow up, is this going to change the way healthcare workers anywhere, whether it's here in Atlanta or Dallas, interact with these potential patients, wearing more gear? What's going to change now?
I think it is certainly very concerning, and it tells us that there is a need to enhance the training and the protocols to make sure that the protocols are followed. The protocols work. We have decades of experience caring for patients with Ebola, but we know that even a single lapse or breach, inadvertent, can result in infection. And so figuring out how all of the things that we can do to minimize that risk, such as those I went through, reducing the number of healthcare workers, reducing procedures to essential procedures, having a site monitor there. These are all things that we'll be looking at closely. We'll go to the phone for questions.
Thank you. We'll begin the question and answer session. If you'd like to ask a question, please press star 1. Please unmute your phone and say your name clearly. I'll introduce you by name. Our first question comes from Dr. Richard Besser, ABC News. May I ask a question?
Yeah, hi. Dr. Frieden, you were saying how difficult it is to implement proper infection control and how one slip can be so dangerous. Is there any consideration of moving to a system where you would move patients to these specialized units where they actually are trained instead of treating them in hospitals where they really don't have that training?
We're going to look at all opportunities to improve the level of safety and to minimize risk. But we can't let any hospital let its guard down, because a patient, an American returning or somebody else coming into this country who had exposure and maybe didn't even have an awareness of that exposure, may become ill. So we do want hospitals to have the ability to rapidly consider, isolate, and diagnose people who may have Ebola. Again, anyone who's been in Guinea, Liberia, or Sierra Leone in the past 21 days and who has a fever or other symptoms should be immediately isolated and evaluated for Ebola. So I would distinguish that diagnosis needs to be done anywhere. Then thinking about what's the safest way to provide that care, that's something we'll absolutely be looking at.
Thanks very much.
On the phone, next question.
Thank you. We have Michelle Salcido with AP. Question. Check your mute button. Michelle Salcido. What's for the next question? We have Caleb Hellerman, CNN. The line is open.
Thank you. I was wondering if you could, Dr. Frieden, if you could, or Dr. Lake, if you could say anything more about the kind of extensive contacts, what was the role of this person who's become infected, and also if you could just clarify the monitoring process. I mean, you're saying she was self-monitoring, are some of the other contacts getting in-person visits, or just what is exactly the process for taking her temperature and reporting in, if you could clarify that? Thank you.
So I'll turn that over to Commissioner Lakey, and I do want to really thank the Texas and Dallas health authorities who have been working around the clock since the diagnosis of the first patient and have monitored every one of those 48 patients and taken their temperature and have now intensively surged to address this latest development.